Imagine this: you're on holiday in Germany, strolling through a picturesque town when you trip and injure your knee. Within hours, you've seen a specialist, undergone an MRI scan, and scheduled a follow up appointment for treatment. Now, compare that to what would happen back home in Britain. You'd likely wait weeks just for a GP appointment, followed by months on an NHS waiting list before you even see a consultant. This stark contrast highlights a critical issue. While the NHS remains a symbol of national pride, its inefficiencies are undeniable. Long waiting times, staff shortages, and worsening health outcomes have become the norm. If we truly care about universal high quality healthcare, we must ask, is there a better way? For decades, the NHS has been seen as untouchable, a system beyond criticism. However, across the developed world, Britain ranks near the bottom in key healthcare outcomes, including cancer survival rates, heart attack response, and avoidable mortality. Despite investing nearly 11% of GDP, comparable to high performing systems in the Netherlands and Germany, the NHS delivers poorer results. The core issue lies in its structure. The NHS is a centralized, state run entity, lacking the flexibility and competition that drive efficiency in other healthcare models. Without major reform, it risks continued decline. The good news is that Britain does not need to dismantle the NHS to improve it. Instead, we can transition to a social health insurance (SHI) system, similar to those in the Netherlands, Germany, and Switzerland. SHI ensures universal health care, not by replacing public funding, but by introducing a competitive environment where multiple insurers operate under strict regulations. This system maintains affordability, prevents discrimination against patients with pre existing conditions, and encourages efficiency. Crucially, it gives patients real choice and providers greater freedom to innovate. In an SCHI model, healthcare would still be universally accessible, but instead of a single government run provider, patients could choose from multiple insurers, both public and private, competing to offer better services. Funding would shift gradually from general taxation to health insurance contributions, calculated based on income to ensure fairness. Hospitals and clinics would gain autonomy, allowing them to operate independently and respond more effectively to patient needs. The result: faster treatment, better outcomes, and a system that rewards quality rather than bureaucracy. A shift of this scale might seem daunting, but Britain doesn't need a radical overhaul. The transition can be gradual, leveraging existing NHS institutions rather than starting from scratch. Integrated care boards, ICBs, which already function as NHS commissioners, could be transformed into independent, non profit health insurers. This would form the foundation of a competitive insurance market while ensuring continuity for patients. Similarly, health insurance contributions could replace part of income tax or national insurance payments, making the change seamless for most people. To minimize disruption, reforms should follow a phased approach. First, NHS commissioners should be converted into SHI providers, allowing them to operate alongside new entrants in the insurance market. Next, funding should transition gradually, ensuring that no one faces unexpected costs. A statutory minimum health benefits package, similar to what the National Institute for Health and Care Excellence, NICE, already defines, would guarantee that all patients receive essential care, regardless of their insurer. Over time, hospitals would gain greater autonomy, enabling them to negotiate contracts, adjust wages, and improve efficiency. The success of this model is not theoretical, It has already been proven. Countries that have embraced SHI, such as the Netherlands, consistently outperform the NHS in treatment times, survival rates, and patient satisfaction. The transition doesn't have to be disruptive. Patients who prefer to stay with their current providers would not be forced to switch. The only noticeable difference would be better, faster, and more efficient healthcare. The NHS was a groundbreaking innovation when it was created, but today it struggles to meet modern demands. Clinging to an outdated system will not save it. If we want to preserve universal access while improving outcomes, we must be willing to evolve. A social health insurance model offers a pragmatic middle ground between state control and privatization, balancing equity with efficiency. Britain has a choice: continue with a system that is failing more people each year, or embrace a smarter, more sustainable approach. The transition to SHI is not just possible, it is necessary. The real question is, can we afford to wait any longer?